What is the first-line treatment for acute otitis media in adults? Options: watchful waiting, oral amoxicillin, nasal decongestants, myringotomy. Correct answer: oral amoxicillin. Which is the most effective treatment for allergic rhinitis? Options: oral corticosteroids, antihistamines, nasal saline irrigation, intranasal corticosteroids. Correct answer: intranasal corticosteroids. What is the recommended management for chronic suppurative otitis media with persistent discharge? Options: tympanoplasty, antibiotic ear drops, oral antibiotics, nasal decongestants. Correct answer: antibiotic ear drops. In a patient with nasal polyps and asthma, which medication is contraindicated? Options: aspirin, corticosteroids, antihistamines, decongestants. Correct answer: aspirin.
What is the treatment of choice for a patient with recurrent epistaxis caused by anterior nasal bleeding? Options: silver nitrate cautery, nasal packing, endoscopic sinus surgery, embolization. Correct answer: silver nitrate cautery. What is the first-line treatment for sudden sensorineural hearing loss? Options: oral corticosteroids, antibiotics, tympanostomy, antihistamines. Correct answer: oral corticosteroids.
In a patient with obstructive sleep apnea, which is the most effective long-term management? Options: uvulopalato-pharyngoplasty, continuous positive airway pressure, CPAP therapy, weight loss, tracheostomy. Correct answer: continuous positive airway pressure, CPAP therapy. What is the management for a patient presenting with acute mastoiditis? Options: tympanostomy, tube insertion, intravenous antibiotics, nasal decongestants, myringotomy. Correct answer: intravenous antibiotics. What is the preferred management for chronic rhinosinusitis with nasal polyps? Options: endoscopic sinus surgery, oral corticosteroids, antihistamines, nasal irrigation. Correct answer: endoscopic sinus surgery.
Which of the following is a first-line treatment for Meniere's disease? Options: sodium restriction, antihistamines, corticosteroids, surgery. Correct answer: sodium restriction. What is the most appropriate treatment for a patient with a peritonsillar abscess? Options: oral antibiotics, needle aspiration, tonsillectomy, incision and drainage. Correct answer: needle aspiration.
What is the treatment of choice for a septal hematoma? Options: needle aspiration, septoplasty, nasal packing, oral antibiotics. Correct answer: needle aspiration. In a patient with chronic otitis externa, what is the recommended first-line treatment? Options: oral antibiotics, topical antibiotic ear drops, antihistamines, nasal irrigation. Correct answer: topical antibiotic ear drops. Which treatment is most effective for recurrent aphthous ulcers? Options: corticosteroid ointment, antibiotics, antifungals, antihistamines. Correct answer: corticosteroid ointment. What is the primary management for a patient with vestibular neuritis? Options: antivirals, antihistamines, vestibular rehabilitation, antibiotics. Correct answer: vestibular rehabilitation. Which management approach is most suitable for a child with recurrent tonsillitis? Options: watchful waiting, oral antibiotics, tonsillectomy, nasal irrigation. Correct answer: tonsillectomy. What is the preferred treatment for a patient with acute bacterial sinusitis? Options: oral corticosteroids, antibiotics, nasal irrigation, antihistamines. Correct answer: antibiotics.